Hi guys, welcome to Talk to Your Midwife session. Now, this here for those who have never seen it or been here, this is a hospital bed, and it's not so much new or so much stressing when maybe you lose a patient from such a bed. But now, the worst part of it is when you lose a pregnant woman who had occupied such a bed. Maybe you lose a woman who is in labor, or maybe you lose a woman immediately after delivery. Maternal deaths are the most riskiest and the most saddest deaths that we have ever gotten. And it is so unfortunate that we are we are getting cases, several cases nowadays of maternal health. What are we missing? What are we not doing? Are our hospitals well equipped, especially here in Kenya? Do we have enough doctors? Do we have enough gynecologists just in case anything happens? To the husbands who have women who are pregnant, how cooperative are you? And how ready are you, especially financially, when you're taking your woman to maternity? Are you that person who says, I only have enough money for a normal delivery because my wife always gives birth normally? Are you ready in case of an emergency? Because an emergency is something that occurs and was not expected. How ready are you just in case the doctor tells you we cannot do this normally, we have to rush to theater? Are you ready financially? Are you ready to cooperate with the doctor? Are you ready to sign a consent on behalf of that woman who is not, that wife of yours who is not able to sign a consent? Or are you that person who says, no, we cannot do this, this is my wife, I know she can do it, I cannot take her to theater, I cannot consent her to go to theater? How ready are you, and how cooperative are you as a husband, as a brother, as a dad, as a friend? How ready are you? And to the patients, the mothers in labor, the mothers going in labor, how cooperative are you when you get into that labor ward? How cooperative are you with the midwife, the nurses, and the doctors? How cooperative are you when it comes to pushing your baby, when it comes to you laboring? How cooperative are you? Because we really need a lot of cooperation from you, so that we as nurses, we as doctors, we as midwives, we can be able to take care of you, we can be able to help you. We need to cooperate, me and you. So mothers, please, when you go to labor ward, I always say, please cooperate with that healthcare worker so that they can be able to help you, because you are there to be helped and they are there for you to save, for us to save your life. You must also allow us to help you save your life. Please mothers, please kindly make sure you cooperate in that labor ward, in that maternity, and also in that theater. And those hospitals who have a maternity, and the good thing, they also have a theater, do you have a gynecologist, an obs-gyn on standby in case you are doing a CS, but there is so much bleeding, that uterus is not well contracting, there is so much trauma in a uterus? Do you have an obs-gyn standby who can perform a hysterectomy? When your MO has failed, maybe your MO has done a CS, but the bleeding is not stopping, you need to remove that uterus. Do you have an obs-gyn in that hospital who you can just press the code blue and the obs-gyn comes directly to that theater and perform a hysterectomy? Do you have an obs-gyn? You have a maternity, you have a maternity theater, you need to have an obs-gyn standby, so that we can try all our best to save the lives of mothers who maybe get so much bleeding, and they spend so much time, they waste so much time waiting for an obs-gyn to be called to come and perform a hysterectomy and save the life of this woman. kindly, all the hospitals in Kenya, in our country Kenya, we need to be on the forefront to save the lives of all women who are coming to deliver in our hospitals. And by doing that, you need to have enough nurses, enough doctors, enough midwives, and enough obs-gyns in those hospitals. Please, our hospitals, those hospitals who have maternity, do you have a theater? In case you have a failed labor, do you have a theater where you can rush that woman immediately for an emergency CS? In case you have a cord prolapse, do you have a theater standby so that you can be able to save the life of that unborn child? You have a maternity, but you don't have a theater. You are failing as a hospital. Are we nurses doing our best in making sure that we save the mothers' lives and the unborn babies' lives? What are we really not doing as healthcare workers? What is not happening? How are the structures of our hospitals? How are the organizations of our hospitals when it comes to taking care of pregnant women and taking care of women in labor? Are we well equipped? Are our hospitals the best places where mothers can come fully comfortable and most courageous and hopeful to come out safe and alive with their newborn babies? So always pray again and again and again. I say, I come to you, I tell you, sign this consent. Even before signing that consent, make a prayer. God, I am signing to go into theater for us. Yes, please God, guide me, protect my unborn child. And please God, this Esther who is going to scrub for my CS, this Dr. so and so who is performing my surgery, I want you to guide him. I want you to be with him as he does this. In case of anything, God, take control, because God always wants us to keep praying and keep calling him, because he's always here. But it is like a dad. When you are asleep, your child has to call you so that you wake up and ask the child, Baba, Mama, what do you want? How can I help you? The same way with God, we need to keep on calling the name of God. In maternity, in clinics, in even medical surgical wards, all over, we need to keep on calling God. I always say, when you're praying for yourself, when you are as a pregnant woman, as a family who is expecting a newborn, a new member of the family, when you're praying for that pregnancy, remember to pray for the nurses, the doctors, and the midwives who will take care of you, even when you're going for your routine ANC clinics. Always remember those doctors so that they can have God's intervention in them, so that they can be able to recognize anything that might be dangerous to you and to your baby. When you're coming to labor ward, you find me. Do not be there. Do not be the one saying, this nurse, I don't love the nurses in labor ward, but I'm here for you. Pray so that God can bless me, so that God can change my attitude, so that I may be the best person to attend to you. Pray for me. I am a human being, so pray for God, for me from God. Pray for me. Pray for that doctor who will perform your CS, because after all, it is God. It is God who can help everyone. It is God who has it all. And for our spiritual leaders, we also have a role in praying for these mothers, and not only these mothers. Pray for the healthcare workers, because we are also human beings. We need prayers. We need God. We need God's intervention. We need God to give us the knowledge, the wisdom, in case there is an emergency. I don't have this and this and this. I need God's intervention at that moment. And me as a healthcare worker, I might not be able to pray at that moment, because maybe I am in panic, because I am losing a woman. So the prayers also will help a lot. So also, everyone, we have a role in praying for the healthcare worker. So generally, everyone has a role to play. Wherever you are, whoever you are, you have a role to play in saving the lives of mothers in labor and mothers who have delivered, in saving a woman who is pregnant. Everyone has a role in saving the lives of unborn babies. Take care of that pregnant woman that you find on your way. Wherever you are, help that pregnant woman in anything that she needs, so that she may be able to carry that pregnancy up to term, and also maybe have that energy to push that baby out alive. So we all have a role. And to the government of Kenya, what are you doing? Are you just in politics? Mayor bullshit politics. What are you doing to the healthcare sector in Kenya? Is it that in Kenya you're looking for oxytocin and cytotec in public hospitals? You cannot even get. The nurses and the doctors have to send a relative, rush to the nearby chemist, go and buy this specific drug because we don't have it in theater, and we don't have it in theater or in maternity, and your wife really needs it. The government of Kenya, what are you doing with all the money you have? And we still have shortages of gloves, shortages of even fluids. Mere IV fluids, cheap IV fluids. We don't have them in the public facilities. The government of Kenya, what are you doing to help save mothers? Mothers are the people who comes in maternity to give birth to newborns, new life. Bring new life to this world, to this Kenya, so that these people will vote for you coming the next years. You as the government, what are you doing now? What are you doing to make sure that the hospitals are well equipped, the theaters are equipped? What are you doing? Are you employing enough staffs? Are you employing nurses, midwives, and enough doctors to take care of mothers in maternity? Or you're coming to a public hospital, you find one nurse having to help like 20 mothers to deliver by herself. How will you be able, out of 20 lives, how many lives can me as a nurse, one nurse, be able to save? Even if I have magical hands, I might not be able even to save 5 of them, 5 of mothers, 20 mothers. So please, the government of Kenya, you have a role to play. Everyone has a role to play in saving the lives of women in maternity, mothers in labor. To those sisters, those mothers, those friends, female friends who take their other female friends to maternity and labor ward to deliver, are you that person that only goes there to take videos of your fellow woman during labor? Are you that person who is there to post anything, any mistake that a nurse does or a doctor does? Something happens, you're there to record that and post it on TikTok, on social media. Are you that person? Or did you go there to give psychological support and also prayers, offer prayers, because this woman in labor might not be able to pray for herself? Are you going there to post things in social media and take videos? Or are you going there to note the mistake that a doctor is doing? Or did you go there to pray for this woman in labor? Did you go there to pray for these doctors and nurses who are going to take care of her? What did you go to that labor ward to do? We should also ask ourselves that, because we can also be people who are also leading to uncooperation of the patient and the doctors, and eventually things go wrong. So what did you go to that labor ward to do? Why did you accompany this woman into labor ward to do? What did you go to do? What was your role when you were escorting her in that labor ward? What are you coming to do with her? You need to understand what you're coming to do. Are you coming to help the doctor save the life of this woman? So guys, let us all play our part in making sure that we are saving women and mothers in labor, and also in maternity, who are pregnant, those who are pregnant. Let us stop maternal deaths. Let us all do our best to make sure that we reduce the maternal deaths that are in our country and generally in our whole world. Yeah, and by doing this, we will be happy. We will live happily. So let us all play our role, and let us stop blaming nurses, doctors, and also hospitals because of things maybe that are happening, unfortunate things that are happening. Remember, life belongs to God. Anything that happens, somehow we don't, let us learn to be those people who leave things to God, because God knows why. God can answer why. God knows everything, everything. He knows everything. So thank you guys.